partners include the UAF Alaska Sea Grant Extension Office, the Cordova chapter of the Prince William Sound Audubon Society, who hosts one lecture a month, and the United States Forest Service, who donates the building and equipment. My name is Meadow. I work for the Science Center. I organize the lecture series and other educational programming. If you have any ideas for lecturers or subjects, please let me know afterward. We run Tuesday night lectures from September through April. Coming up next week, we have the Science Center's own Pete Rand, who's going to talk about his past research with the endangered giant salmon of Japan. I'm going to pass the sign-in sheet around in case anybody missed it. And our speaker tonight is Dr. Debra Cherry. Debra is an associate professor in the Department of Medicine and the director of the Occupational and Environmental Medicine Residency at the University of Washington. She completed medical school at Texas Tech, a master's degree in environmental science at Stephen F. Austin University, and the Occupational Medicine Residency at the University of Texas Health Science Center. From 2000 to 2013, Debra served on the Occupational Medicine faculty at the University of Texas Health Science Center. And from 2013 to the present, she has been faculty in the Occupational Medicine program at the University of Washington. Debra is going to share the results of the 2015 UW Sea Grant Commercial Fishing Health Study, which assessed chronic health conditions and habits among our very own Cordova gillnet fleet.
Thanks so much for coming out tonight. It's really a pleasure to be with you and to share these results from the study. It was definitely a group effort, and Tori Baker, as you know, was a key partner in getting this study together. The study was funded by our Pacific Northwest Agricultural Safety and Health Center, which is funded by NIOSH, which is a federal agency that funds a lot of studies on occupational health. But we were just thrilled to be able to do this study here and partner with the local people who helped us here in Cordova.
Should I dim the lights, Debra?
Sure. I'd like to make this as interactive as possible. I have about 25 slides. I mean, I don't need the whole hour. I'd love to get your feedback and thoughts about the study and the results as we talk about it. It was a real pleasure to be able to do this study. I've never done a study of commercial fishermen before. In my prior career in Texas, I really didn't see any fishermen. So this was just really fascinating to me to learn more about the industry. And it really has a lot of appeal. I mean, the occupation does. One of the fishermen told me, I just didn't want a 9-to-5 desk job. So this is a lot more fun, I think, than any 9-to-5 desk job. And frankly, I don't like a 9-to-5 desk job either, so I'm so glad I got to come out here and share a little bit in the adventure of commercial fishing. Commercial fishing is one of the most dangerous occupations because of the high risk of injury and fatalities, and that's pretty well known. But what hasn't been studied as thoroughly is the chronic disease risks that might occur as a result of the occupational exposure as well as just the lifestyle. So some of the occupational and sort of lifestyle factors that fishermen are exposed to include long irregular work hours. I mean, as you know, the fishing might take a 24 to 36 hour shift before you can get any rest, which is a lot like medical training actually. Inadequate sleep is a problem. Physical strain, you know, just from picking the fish out of the net or bending a lot. Noise from the diesel exhaust, or from, you know, these are rugged outdoorsmen or outdoorswomen. So a lot of them have hobbies that also have loud noise exposure. Exhaust and chemicals can be a hazard. Social isolation, being out on the boat, is a risk factor for depression. UV radiation from the sun, which may be less in Alaska than other parts of the world, like the Gulf Coast, but is still can be a risk factor for skin cancer. This, we switched from a Microsoft Office version and ran this on a Mac, and so I think my slide, this is odd how this is trying to get down here, but I apologize for that. I think that's just a...
Inadequate sleep.
Yeah. Yeah, it's a medical problem. Anyway, so the purpose purpose of this study was to first test the feasibility and acceptability of our methods. You know, that's not very exciting because people want to know, well, what were the results? But these methods had never been tried before. We developed a new survey, a new exam protocol, and it was kind of DIY. I mean, those of you who participated know we used like a tablet app for the audiogram, and we used just a step test for it to do the aerobic fitness assessment. And we tried the remote synchronization of Fitbits, which really was not a validated method. We just kind of wanted to see if it would work. So kind of mixed results there that I'll show you in a moment. But if we could get the methods to work, then we wanted to characterize the chronic health risk and health status of the Copper River gillnet fleet. And we wanted to develop a health risk appraisal and exam protocol that could be used in other populations of commercial fishermen. So our methods, what we did was we mailed an invitation to participate to the 633 gillnet permit holders for the Copper River Basin area, I think area E4. And we invited them to complete an online survey. And everyone who completed the first survey was invited to complete a second survey, which was in the middle of the fishing season, because we wanted to compare habits before the fishing season and then during the fishing season. Then we asked 10 people to wear Fitbits. I think we have 9 there because one was lost. And then we did a detailed history and physical exam on 21 fishermen here in Cordova. One of the things we did was come out to the health fair in April and try to collect some paper surveys. We had both the web-based version and a paper version, and so Tori was kind enough to share her booth space with us, and she has great influence over fishermen because whenever she asked someone to come over and fill it out, they would come complete it for us. And that's just a picture of someone taking the paper survey. So here are the results we got. In terms of feasibility, we got about 66 of 633, or 10%, took the first survey. That's kind of a low response rate, but that's about what you'd expect if you just mail out a letter and ask someone to go to a link. It's not great. So the downside of that is that we probably didn't get a representative sample. I mean, this study is subject to volunteer bias, so the people who actually responded may be healthier on average than the whole fleet. It wasn't really a good representative sample, it was a convenient sample.
With that first survey though, there was some monetary incentive, right?
Yeah, $10, yeah.
And still only
Everyone-
66 people?
Yeah, everyone who completed it got $10 cash, right?
Try it again this year.
Okay.
Yeah, it was a tough season.
Was it? Okay.
It might work then.
Yeah. And they got another $10 for the second survey, and then about 41 of the 66 completed the second survey. And, just in terms of feasibility, I mean, we found one item that just wasn't usable at all. Like we asked, how sleepy are you at different times of the day? Like, very sleepy or, very alert. And somehow it just didn't work. I think Toriette pointed out there was a problem with the electronic structure of the question, but we tried to fix that, but still, that one was bad. Anyway, characteristics of the participants on the first survey. The age range was 19 to 73 with a mean of 49, so a little bit older. 61 male, 5 females responded. 64 Caucasian, 2 Alaska Native. We would love to get more Alaska Natives to reply, but weren't real successful there. Most people who replied had a lot of commercial fishing experience, mean of 26 years experience. It was a well-educated group. About 40% had graduated from college and 10% from graduate school. That's a lot higher than the population average. I mean, like the U.S. as a whole, you'd expect maybe 15% to have graduated from college. So this was a really well-educated group. So in terms of the results, the actual questions, most of the participants did report having health insurance and a recent visit to the dentist, which was good. But then there was a minority who did not have health insurance. About 10% did not have any health insurance, and about 38% had not had a visit to the dentist in the last year. You know, the recommendation is to get your teeth cleaned every 6 months. Mean body mass index was 27, which is the overweight category. But that's similar to the state of Alaska, so it's not much different than the general population. It's kind of a national problem, the obesity and overweight problem. One thing that was interesting, about half of the participants were either overweight or had a large collar size. And those are both risk factors for obstructive sleep apnea, you know, where you snore at night and they stop breathing for a bit and then have to catch your breath. And only one person reported having sleep apnea, so we think that, you know, could be underdiagnosed in this population.
Debbie, what does the collar size have to do with apnea?
If you have a large neck, that's increased risk. It kind of goes along with obesity. There's more redundant tissue in the neck. It's just increased risk for the airway being obstructed at night.
How would a person know if they have sleep apnea?
Usually the spouse will report the person snoring and, you know, catching their breath at night. Like, seems to stop breathing and then, like, you know, suddenly have to catch their breath.
But if someone was go to the doctor and say, I suspect I might, or that I might be at risk, how do they determine that?
Sleep study.
Okay.
Yeah.
Because I think that probably would be part of the underreporting is, who knows?
Yeah.
You know, I mean, unless you actually go to a doctor and get it diagnosed and go through all the rigmarole and
Yeah, it is a bit of an ordeal to get it diagnosed because the sleep study is kind of hard. You have to go overnight to the hospital and be hooked up to these monitors.
But here we have to go to Anchor.
Yeah, so that's even harder, right? They're supposed to make a new test to make it easier to diagnose. Like the poor man's diagnosis is just to have like an oxygen monitor, a pulse ox on your finger at night. And like if your oxygen level drops, it alarms. And you
so
know
it's sort of like the Fitbit, it reacts
Yeah.
during that moment, or it's not like an oxygen level overall, it would actually let you know at that point in time.
I don't know if you've ever been to the doctor and they check your oxygen level just with that thing on your finger.
Okay.
So if you could have continuous monitoring with that. There's actually, I think there's an iPhone app that's supposed to diagnose sleep apnea.
Okay.
It comes with the oxygen monitor or not, but it should be easier and cheaper to diagnose than it is now, and I think that's going to change. And when it gets easier to diagnose, maybe we'll know the true prevalence.
All right.
Yeah.
Danny Gilbert's pretty good at helping you figure it out, and he also happens to sell these pretty snazzy mouthpieces that help you resolve it. And I can vouch for the fact, I was probably the only person that admitted it in the damn study, but it makes a hell of a difference, and domestic bliss is one of the differences.
It's a great testimonial.
Okay. Thanks.
About 80% reported exposure to loud noise in their hobbies, which we'll see in a moment. That's about the same percentage that had noise-induced hearing loss and those that volunteered for the physical, but we don't know if it's the same people who had hearing loss and loud hobby exposure. So musculoskeletal pain by body region in the last 3 months was one of the questions we asked. And you know, we did ask if it was sort of mild, moderate, or severe, and these numbers combine those categories. But it was really striking to me that 47% reported some kind of shoulder pain before fishing season ever started. That's pretty high. I mean, I would think 10 or 20% would be more normal. So 47% is pretty high. You can see elbow, forearm, 12%, wrist, 20%, hands and fingers, 23%. Low back, 33% reported low back pain before fishing season ever started. That's not really unusual either. I mean, the prevalence of low back pain is about 25% in the population. And, you know, if you look over a 3-month period, that's in the range that doesn't seem that unusual, really. But the shoulder pain seemed unusual. That seemed like a lot. Knees 26%, ankles and feet 24%.
Do you have to age correct your,
We did not age correct these. We didn't do any adjustment for age. The average age of the survey respondents was
47?
47.
47. But you're right, all this pain would probably go up as the person ages. So then we looked at changes on the mid-season survey compared to the preseason survey. And, you know, as you might predict, there were longer working hours during the fishing season. So the percentage that reported working 10 or more hours per day, it was only 10% before the fishing season, and that went to 87%. So most people during the fishing season. Less sleep. The survey asked how often do you get pretty regular sleep, or what percentage get pretty regular sleep, and that went down from 68% to 8% during fishing season. And less activity, no vigorous exercise per week. That was only 11% before fishing season, and it went to 44% during the fishing season. So I think a lot of fishermen, I think, are pretty active people, so most of them are getting at least some vigorous exercise every week during the off season.
I have a question. When you say longer working hours during the fishing, and you took 10%, to 87, and the first one says per day, but if they're open one day and off 2, and then how do you account for that, or just did it play into it?
Our question wasn't really sensitive enough to account for that. It just said, how often do you work 2 or more hours a day? I don't have the question in front of me, but it was something along those lines. And we saw, and these last 2 were not really statistically significant, so I'm not sure. I mean, we would have to investigate it further to know if it's even really real. But if we asked, what's the most drinks in a day that you drink? And so on the first survey, 23% of the respondents said they drank 5 or more drinks on the most drinks they had in a day. And that dropped to 15% during the fishing season.
On the less activity, it sounds like there was less vigorous exercise during fishing season.
Correct.
Right? That's where.
That's correct,
Yeah.
yeah. Just out on a boat, so there's nowhere to exercise, I guess. I mean, they're moving their arms, but I guess people don't consider that vigorous activity. I'm not sure. The percentage who used pain medication every day increased from 1% before the fishing season to 8% during the fishing season. So I guess I think that kind of makes sense. Maybe they're having more pain when they're fishing because of the awkward postures and repetitive arm stress. This is just a picture we took of the salmon spawning. So beautiful. Okay, so that's the survey results. Now I'm going to go to the physical exam results. And we did a fitness assessment, hearing and vision assessment, and a complete history and physical on everyone who volunteered, which we had 21 participants for this part. And I just listed the findings of concern here. The most surprising thing to me was finding noise-induced hearing loss in 80% of participants. And again, we just used the tablet app, so I don't know how accurate the test was. And it's not as accurate as a sound booth test that you would get from a professional. But we did have 20% who had normal tests, so it did look like 80% had noise-induced hearing loss, which is a very characteristic pattern where there's sort of a dip in your hearing at 4,000 hertz at that particular frequency, and then recovery at 8,000 hertz, which is a higher frequency. So 80% had that noise-induced hearing loss on the audiograms we did. And you would expect only 10 to 20% in the general population to have that much noise-induced hearing loss. There were a variety of upper extremity disorders. There wasn't any one thing that just stood out too much, but altogether it seemed like a lot of upper extremity disorders. We used to have 8 cases of shoulder or rotator cuff disorders. I would expect 4 or 5 cases in 21 people in the general population. So 8 cases is more than you would expect. Again, it's a small sample, so we don't really know if it's statistically significant, but it's something that might be followed up. 4 carpal tunnel cases where I would have just expected 1 or 2. And repetitive forceful movements of the wrist. That is a risk factor for carpal tunnel, so it kind of makes sense. 3 cases of tendinitis of the wrist we observed, and we'd only expect maybe 1 or 2 in 21 people. 3 miscellaneous disorders of the fingers. That's about what you'd expect, really. And 1 each of a biceps tear, labral tear of the shoulder, golfer's elbow, and cervical neuropathy. So, again, there wasn't any one thing that just stood out, but all that together is a lot of upper extremity disorders.
And this was how many people?
21 people. And then these findings seem pretty typical. We had 4 people with 4 cardiovascular fitness based on the step test. That's not that unusual. 3 had high blood pressure. 4 needed an update on their glasses. 5 had back pain. That's actually kind of a normal prevalence for back pain, which is one of the most common problems that people have. And 7 were obese. That's about 33%, but that's pretty normal for the U.S. Do you have a thought, Tori?
No.
Okay. Now, I had a feeling that back pain might be worse than usual in commercial fishermen, but this may have been a particularly healthy sample. Again, it's not necessarily, it's not a representative sample. It was a volunteer kind of sample, so there may be a problem with back pain, but we didn't really see more than expected on our exams. And my co-investigator, Dr. Miller, thought we had way too much obesity, but it's pretty normal actually what we were seeing. This just shows prevalence of self-reported obesity in the U.S. and in Alaska it's about 25 to 30%. Obesity increases with age. We had a little bit older than average sample, so I think the obesity is any worse than anywhere.
But this was self-reported.
Yeah.
The previous wasn't self-reported,
Right,
right?
right. So what we got was, we actually measured about 33% of our sample who we did physical exams on was obese. And you're right, this is self-reported data from a national survey where you get 25 to 30%.
Well, a lot of people that are technically obese by they don't think they are? Because it surprised me, I don't think a third of our kids obese.
Yeah.
I don't, yeah.
Yeah, I definitely have a problem with the obesity test. I was one of the people found obese, and I know I'm heavier than I should be, but Phil Ullman, who was also in the test,
Yeah.
was just pronounced obese down south. And he definitely is not in my mind. So, I mean, if you just take height and weight and say, yeah, that guy shouldn't be that heavy for that height, I mean, realistically, if you take someone who has high muscle mass and they're short, they're gonna be considered obese by these numbers.
That's
So,
true, yeah, if you're very muscular, you can have a high BMI, but not be obese.
so I just think that the obesity number, I think a lot of people blow it off because they feel like it's not that accurate. And I don't know, you know, in a study like this, how you could make that more accurate. And I think obese is a really, I don't know, it's a weird term. It's a little bit like back pain. Do you have back pain?
Yeah,
Some of us feel like back pain means you can't get out of bed in the morning.
yeah,
And other
yeah,
people feel like, oh, my back's a little stiff.
yeah, yeah.
So anyway, I think that might be one of the reasons why that number is so high, is that,
Mhm. Yeah, it's not perfect.
Did
Percent
you-
body fat would be a better measurement.
right.
Mhm.
Okay, so you just used BMI, you didn't do any of the fat tests?
We didn't do a fat test, nope.
Okay.
I was gonna bring my fat calipers, but I didn't. We just went by height and weight. So, those were the physical exam results, and again, I didn't mean to belabor the obesity, because to me, the most striking findings, as I indicated in that first slide, were the noise-induced hearing loss, the shoulder problems, the carpal tunnel, and the upper extremity disorders.
Yeah, but you had a lot of people with over 20 years on boats, and the hearing protection probably started really coming in when? 10 years ago?
10, 15.
Yeah, that's what I heard a lot of people say.
And then I think, as she's pointed out, I mean, you know, this population is probably also involved in hunting, in flying, in a lot of noise-rich environments.
Right.
That this is probably just one part of it. But yeah, but I think it is interesting that you were able to pick up, you know, even with your app, a positive signal that this is noise-induced damage.
Right.
And not just
Not just age-related.
age-related.
Right. So then we did the Fitbit monitoring. And we asked 10 participants to wear our Fitbits for 72 hours before, during, and after the fishing season to monitor their activity and sleep habits. And they were supposed to synchronize remotely. You know, you could synchronize the data to any computer with internet access, and then we were able to access those results. We'd kind of set up the identified username and password. We had some logistical problems with the Fitbits. One device was lost, so we were down to 9, but that was actually better than anticipated. I was afraid several would be lost out on the boats. You know, but actually only one was lost, and it was not even on the boat. And we had a couple of instances where either the person never synchronized or they never wore the device after they got this. We're not sure which, we just didn't have any data. In some cases, there was failure to log the sleep consistently, because you kind of had to do that manually, like you have to push this button and hold it when you fall asleep and push it when you wake up. So that the device isn't smart enough to just know when you're sleeping. You have to tell it when you're sleeping. We had some cases where steps were recorded where their participant told us they were really not active, like it shouldn't have been logging steps, but it was logging steps. And then we actually ran out of time for the postseason recording. That was a little too ambitious, so all we really got was the before and during fishing season results. So even though it didn't work too well, we had some concerns about the data, I will show you some sample data. Hours of sleep before fishing and then during fishing season. So this participant was sleeping about 6 to 8 hours a day for 24 hours before fishing season, but then just like 1 to 6 hours in the middle of fishing season. So definitely sleep was reduced for this person.
When was the before fishing?
Excuse me.
When were the before fishing numbers taken?
Like,
Anytime before May 15th.
yeah,
Anytime before the first opener. We got the Fitbits passed out by about the time of the health fair. and then that's when people sort of chose what was the best 72 hours for them to report.
I was just wondering, because I wouldn't consider the first opener the beginning of fishing as far as people's sleep cycles necessarily,
Yeah.
or other things.
Well, I think it was just, we needed a starting point. So once you got into the fishing mode, which I think there's sort of that ideal that, you know, once you're out on the boat, that's when you're not sleeping. Well, I mean, all of us know sometimes being out on the boat is the best time because you're just in such a panic to get ready to get out, and you're working extremely hard and fast, and, you know, so we figured it would be a good, at least, starting point. And I think, I don't know how, I mean, I don't know when people who participated in that part of it did their 3 days, but
Mhm.
it was kind of a
Yeah,
arbitrary
that
starting.
was a flaw, I think a flaw in the study design is we didn't really ask for enough information. It would have helped for us to have a detailed log of what people were doing.
Yeah.
You know, like, because we got the during fishing season data, but then we didn't really know if they were fishing all 3 days or if it was like 1 day out and 2 days back on shore. So, to do a real sleep, that's one thing I found about this pilot study. To do a real sleep study, it takes a lot more. Sleep is complicated. You really have to have much more careful logging and measurements than we really had. Steps, again, this may not be accurate because I felt like this person had about 6,000 to 8,000 steps before the fishing season, and then over 6,000 each day during the fishing season. So I'm sort of skeptical, like, were they really taking that many steps on the boat? Like, it just didn't make any sense. I
Mine
would
was-
expect the steps to go down.
Mine was.
But it feels
recording
like it.
When it was choppy,
Yeah,
you know, if you're running in the boat and it's choppy,
yeah.
it was recording the same as if I'd been hiking, so
Yeah,
that
yeah.
could throw it off.
I think the other thing, I was wearing mine on my wrist, and I was picking fish. And so, you know, at one other time, I wore it before the season, and I played the piano for 2 hours, and I had 12,000 steps by the time I was done. So there was a little bit of gaming possibility there, but
Yeah.
it was, but again, I think this was sort of neat about this study, was to try and use some of this newer remote technology to see if you could, in a pretty hostile environment, still capture some of
Mm-hmm.
the
And
data, so.
some parts of it did work. I mean, you could synchronize remotely. I mean, that part worked. We were able to see the data. I just think Fitbit devices overall may not be very accurate. I mean, if you are walking, like, you can maybe tell how many steps you walk from day to day if you have a consistent routine. But for us, looking at it remotely and not really knowing what the person was doing, we didn't really know if these were real activity steps or just an error.
Or boat motion.
Yeah. So other concerns that some of the fishermen raise, like someone asked me, well, will I get cancer from these Exxon Valdez chemicals that contaminate the environment? And that's a really difficult question to answer. I just thought I'd throw out some broad statistics about cancer or some facts and figures. The general population lifetime risk of developing cancer is 1 in 2 for men and 1 in 3 for women. So there's a very high chance that you will get cancer if you live long enough, whether or not you're here or somewhere else or what chemicals you're exposed to. In advancing age is the greatest risk factor for cancer, so the best way not to get it is to die early of a heart attack, I guess. So, go with that option, right?
I'm looking forward to that.
Yeah. Occupational and environmental factors, the estimates really vary, but may account for about 10% of overall lifetime cancer risk. Sun exposure is a big risk factor. Sun exposure accounts for about 90% of skin cancer. Smoking accounts for about 1/3 of all cancer overall. So if you don't smoke and you use sunscreen, you reduce your risk quite a lot. The latency from the time of exposure to the development of cancer is decades, so it's really hard by the time you get cancer to say what happened 30 years ago that you were exposed to that might have contributed. But the Alaska Cancer Registry does track new cases of cancer, so you can go on their website and look at the incidence rate of cancer by region. I went on there, I didn't see any evidence that Cordova has a higher rate than other areas of the state. Looked like Cordova is about the same as the rest of the state. But I did see a study that showed, this is from California, and they looked at the occupation of all California residents diagnosed with acute myeloid leukemia, which is a rare type of cancer. And if your occupation was in the fishing industry, and they didn't specify if it was, what type of fishing or anything like that, but if it was in the fishing industry, there was a doubling of the risk for acute myeloid leukemia. Now that just means it's a rare cancer, so the incidence would go from like 1 in 200 if you're in the general population to 2 in 200 if you're in the fishing industry. So it's not much of an increase in the absolute risk. So there may be something about fishing that has a cancer risk, but it's not huge. Someone else asked, will I get lung disease from the diesel exhaust on the boat or from other chemicals? And diesel exhaust does contribute to a variety of health effects. Usually just contributes a little bit. Like if you have pre-existing heart or lung disease and then you're exposed to diesel exhaust, you're maybe 1% more likely to have a worsening of that condition. So it's much worse if you're exposed to something like that in a confined space, and much better if you have good ventilation. There are other chemicals that you may use in getting the boat ready, like the paint, solvents, glues, or cleaners. It's really important to use those in a well-ventilated space because there is a risk of irritant-induced asthma from some of those chemicals. Picture of a boat we enjoyed seeing all the fishing boats. So it's just from doing this study for the last year and thinking about it. This is some advice I might give to fishermen. Make sure you wear hearing protection, and a good rule of thumb is if you're at arm's length away from someone and you have to yell to be heard, you should be wearing hearing protection. That's like a dangerous level of noise. And that should apply whether you're fishing or just in your hobbies. Get a checkup before the fishing season starts, like in January or February, because the activities of fishing are so demanding. It's good to be in the best shape you can before the season starts and address anything like rotator cuff or carpal tunnel or sleep apnea that you might have. Some kind of conditioning program, especially for the upper extremities before the fishing season starts, I would think would be beneficial. I don't have any scientific evidence to say that that's definitely true, but it seems like there's a lot of rotator cuff and carpal tunnel, so you want to get in shape. There's an ergonomics course for commercial fishermen that AMC puts out. Has anyone taken that?
We've not had it in this community. It's been offered down at Fish Expo, but we haven't had it here.
Okay. I just looked at their materials online. It looks pretty good. I know Jerry Dugan put that together. I think he's a good resource for the fishing industry. So that's what I would advise maybe individuals based on these results. And then for follow-up study ideas, we don't have any additional funding right now, but it would be great to sort of brainstorm and apply for additional funding to follow up on this study. It'd be nice to have a focus group with local stakeholders first, get some feedback about ideas that would be beneficial. We can further refine the survey and exam tool, maybe into something that could be even, you could do a self-assessment, or it could be administered maybe by the personal trainer at the local gym. And then it would be interesting to sort of randomly assign volunteers to get either a conditioning and assessment program or just, usual or no intervention, and see if the people who get the intervention really have health improvement. And then regarding hearing, it would just be interesting to see where the noise exposure is occurring, if it's really during hobbies or during the fishing season. And I just want to thank partners. This was really a collaborative effort. It was a lot of fun. Again, Troy Baker was just instrumental in getting people to participate, but also helping to design the study. Paula Kohlenberg from the Sea Grant program and Jennifer Lincoln from the NIOSH office all really helped with the study. Our UW study team, Carly Miller, she got married, so now she's Carly Eckert, graduated from our program at the end of September. I'd hoped she could come and give this talk actually, but she graduated from our program. And then Philip, our program assistant, who took the pictures that you saw. And Melissa Guy in the Cordova Community Health Center donated the space for the exams. That was a huge help. That just worked out perfectly. And CDFU helped publicize the study with their email list. And Julie Wolf is a nurse who just took us under her wing and kind of showed us around town. And also, thanks so much for the participants, especially the ones who gave us the salmon samples, which were delicious. So, any questions or discussion about the findings or follow-ups?
Well, one of your slides made me think of a question, and so, for example, diesel fuel for me, I've become more sensitive. I've increased sensitivity as time goes by, and I was just kind of curious if that relates to anything going on inside the body. Does that mean that
What does that mean?
you've reached a toxicity level? Or
Well,
is it just because of exposure over time and it's
Talking about smoke or the
Sensitive
I'm
out.
what are
saying
the symptoms that you're
the
having?
smell?
diesel fuel?
Yeah, it's
So,
more like fuel
liquid.
opposed to the exhaust.
Is it like you're wheezing or getting wheezing or shortness of breath?
No, it
or
just
more
kinda
like
starts
just
making me
nauseated or headache or
Yeah, just kind of more like sick. It just kind of makes me sick.
like the odor? Is it more like the odor?
Yeah, where it never used to. I was just kind of wondering if it's my body telling me something, or if it's just that
Go
just
gas,
happens.
go gas.
I think it's gotten worse with this new low sulfur fuel. I noticed the difference between the old stuff and the new stuff, and the old stuff is not as, didn't seem as bad.
I'm with you, Brent. I'm finding over the years that I'm more sensitive, and I'm sensitive in the way of just lightheadedness and almost not nausea, but I just immediately am repelled. I find myself just reacting like, oh God, that's, I want to get away from the diesel.
Yeah.
And I just say that sort of generically, but I found that it has increased over the years.
Because
That
you
does
were
not
talking about
sound-
latency.
Yeah,
for,
yeah,
For
for
certain things that you
cancer,
get
right.
exposed to,
Mhm.
and 30 years later, you develop something.
Yeah, yeah.
And I was kind of wondering if your body doing a little reminder or something.
That's kind of a complicated question because there's probably kind of an odor response that gets more exaggerated over time, but also it does make people sick. And we're doing these studies at UW. In fact, my department chair is where we put people in a chamber and then pump in different levels of exhaust, diesel exhaust. And then we have them monitor how they feel like for a few days afterwards. And the ones who have
How are they?
You paying for this study?
yeah,
You get a fit
more
for
than
that?
$10. You want to sign up?
Yeah,
We do it to ourselves.
maybe in the spring.
So yeah, people report being sort of fuzzy-headed or, have a headache for like hours afterwards. So there's the immediate effect. And then there's, long-term studies where they have high air pollution and it can, well, I guess it's not quite the same as diesel exhaust. We live near a highway. There's a higher incidence of heart and lung disease, but it's just slightly higher, like 1% higher or something.
Hey, what I think is that these fishing boats, these gillnetters out here, as opposed to the sanders with the stock coming out, but man, these gillnetters, including myself, they're just in this horrible, smoky environment. It's incredible.
Yeah.
day after day, you're just sitting there and it's amazing. And there's, like, I know in Bellingham, Washington, they have these diesel generators they were gonna use and blah, 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 and they're, oh my God, we can't do that because there's 1 ppm or whatever, but we're talking about super soap and diesel exhaust. I mean, that's what I'm seeing.
Yeah.
I've seen people where they had engine malfunctions, where you couldn't even see their boat. It was so smoky,
Yeah.
you know, and they were living in that right
Yeah.
there.
That's not
Yeah,
healthy, I
it's
can tell you
amazing.
that. Yeah.
I have a question, or I guess just some thoughts, is possibly going forward, you may be able to form some sort of partnership with CDFU. Maybe that there's some funding opportunities out there, some grant opportunities, to eventually provide preventative education to fishermen. And then maybe 2 areas that you could expand the study to if you were to go forward is to look at your crew members, because he gillnets, he's been gillnetting for years right alongside
Yeah.
his captain. And there's, for example, he picks a lot more fish than his captain does, and as a result has more injuries at a certain point. And then also maybe your canneries. I mean, it's different than fishermen, but it's still involved in the commercial fishing industry. That would be harder because it might be harder to say it's not the same people coming year after year, but you might be able to do something with that. I would imagine that people standing up in long hours in the canneries would have probably a lot of the same, you'd probably find a lot of the same results, the hearing loss, upper extremity injuries or problems. Yeah, people that work on tenders. Another thought is that possibly a good way to monitor what people are doing during fishing is you could make sort of a journal or a log. I mean, a lot of people, that seems like that might be more possible for if you just gave people these little logs to fill out as you're fishing. When you have your downtime and you're waiting, you could fill out a log. Possibly.
Yeah.
But I hope this continues. It seems like a really valuable thing to study.
We didn't have a list of all the deckhands or a list of the cannery, well, we weren't gonna go to cannery workers. I think that's a good population to study, but as far as people who are doing the fishing, it's just that we didn't have the list of everyone.
Yeah, if you,
Yeah.
long term, or if you had something that you could hand out to captains, they could also get, because there's a lot of information there with your crew, too,
Yeah.
that would be pretty much the same. And then I just had a question on the hearing loss part. Was there any correlation, or did you study this at all, the correlation between people that have been fishing longer and older, not that it's always gonna be the same, and people that, I guess my question would be, did you see if people have been fishing longer, did they have more hearing loss? It seems like there would be more hearing loss versus people that are new to the fishery having less hearing loss. I don't know if you had looked at that at all. It might be
That
something.
would be interesting, yeah.
down
They
the
could be
road.
age matched, maybe like if they were an older individual who just entered the fishing industry. Maybe. But that would have to be a bigger study, but that's a good thought. Because we just had 21 people, so if we had 100 or something, those would be good questions to ask.
And yet, I guess maybe another thought, this is a little bit bigger, sorry, I have all these thoughts, is and this might be totally different, but you could see if there was any benefit. I'm assuming that a lot of fishermen eat salmon. We probably eat more salmon than your average population across the United States. If there's any benefit, we know the benefits to that, but if that actually would show up in a study that, fishermen that are eating their product are healthier in this way, less healthy in other ways, more healthy in this way, something else to study.
Maybe less heart disease because of the fish oil.
I feel fine.
Good, good.
Higher BMI because of the fish oil?
Yeah, maybe. I don't think so. It's just pretty low.
What I'm saying, because my parents, they grew up in a rural Colorado,
Yeah.
and you see it, what I'm trying to say is that there's amongst a lot of population, a big percentage of the population, even to this day, there's this idea that you can't go out sort of recreationally exercise. There's this, you've got to be working, or you can't. I've been for many years. I've been daily exercising in wintertime. That's what I love to do, and it's really helping. Actually, People, but most people don't do that stuff.
Mhm.
I'm pain free. I am. I'm pain free, and I'm 68.
Yeah,
You know, and I owe it to good diet, and Nancy's yoga just in. I live in Bellingham, and I always access a lot of really good food, and I exercise almost daily. Hell, I just did it. You know, I think it pays off. I mean, I think actually it pays off not just for the fishermen, but for the community in general. Hell, I really do. Am I on my soapbox?
It's a good one, it's a good one, it's
Yeah.
a good one.
I mean, you know, it's.
No, you're right.
you can be our poster role model.
Of all the stuff that I think you have come up with, the sleep deprivation is probably the biggest issue here.
Yeah, I
Yeah,
know that's
we-
important, and we didn't measure it adequately.
One of
like
the
I said.
local businesses that has done really well has done really well with
Salvage.
sleep deprivation, salvaging boats that have ended up on rocks.
Mm, yeah.
And all the fishermen know it's an issue. And it's gonna be an issue with the Coast Guard soon. I'm surprised it hasn't already. So I don't know how much information there is out there on dealing with it. If there is anything you can do pre-season, during the season, after the season, but it's something that we all deal with. And I think it's something as we get older, we have a harder time recovering from. And it's just part of the business. You know, what someone said earlier about what Meta was mentioning was the early season versus the middle of the season versus the end of the season. And we've had fishing openers in the early season that were 6 hours long, and fishing periods mid-season that can go 84 hours or 144 hours in a week. And most people don't fish those straight through, but a lot of people get by with as little sleep as they can and still function. And so I really feel like that's one of the things that affects me the worst, is the sleep deprivation and how to deal with that. You know, can you get a 20-minute nap here and there? Can you go 24 hours and then come home and sleep 24 hours and have any hope for recovery? And I know I've read a lot of stuff that's saying that no, if you lose your sleep, it's
Yeah,
gone.
you can't make up sleep lost to sleep lost,
So,
right?
but I do think that's one of the main things that's affecting this fleet. Just with, looking at the number of accidents we've had the last 5
Well, if you look at truck drivers, they have to log their sleep and they can't drive, except for a limited number of hours. But I guess in fishing, there's not a threat to the public. So
Well, the truck
they're
drivers
up to
get
their-
around it too.
Yeah.
They're supposed to do it that way, but
Yeah, total surgery residents, they're the ones who are still working 36 hours, so I'm trying to
Right.
bend the rules.
We have to take some lessons from like Europe and France and stuff, where they work 4 days a week or 6
Yeah.
hours.
You tell the
a day.
fish to slow down.
That's better, isn't it?
Yeah.
In the canneries here, I sample in the canneries, and I'm an old guy, and we're on call 24 hours a day, 7 days a week, and the longest I've ever worked is 23 hours straight, and sometimes it's 18, but at the cannery during pink season, at one of the canneries here, they work 16-hour shifts, 7 days a week for long periods.
Oh,
All of
sounds
the canneries
awful.
do that. I'm a medic here, and
yeah.
I can attest that during a busy pink year, the ambulance is going to the canneries almost every day. I mean, I myself was called out almost every day for a good stretch of the season. Same, a lot of the same fainting, exhaustion, different injuries happening. People are working 16-hour days, 7 days a week, and they don't get enough sleep, and months on end, and you have, 60-year-old women doing that.
Yeah.
I have another question. Why did you pick, of all the fisheries, why this one?
I wanted to come to Cordova. That's selfish.
Oh, no, it's awesome.
No, and Tori was here, so when this came up, I was in Seattle, and I was with the people from our PNASH Center, which is the Pacific Northwest Agricultural Safety and Health Center, who were funding the study, and we talked about where a study of commercial fishing could be done, because commercial fishing is one of their priority areas. And they said, well, we want to really expand into Alaska, because we haven't done enough there. We've done too much just in Washington, like it's supposed to cover a 5-state area. And people knew Torrey, and it seemed like kind of a small population that you could kind of wrap your arms around.
And I think the other thing too is that this is one of the longest gillnet and salmon seasons in the state. So trying to do one of these sort of in-season, pre-season longitudinal studies, and the fact that this fleet is now pretty well digitally connected. I mean, you know, and that was an opportunity for them to try out some of this
That's
technology.
right.
So it was neat. When they kind of
thought we
arrived on
could-
my doorstep, I said, oh yeah, I think we could give this one a whirl.
Did any of your 21 people go seining as well? Like, do they do both, or do you know if they do both? Like, go gill netting, and then as soon as gill netting was,
There may have been one or two who did both. I don't recall for sure. We did ask them kind of about their occupational history. I don't think that was common. Yeah. I don't know if there are best practices for sleep habits for commercial fishing that have been published. I mean, it's just, the nature of it's pretty difficult, right? I mean, you have to be up for 24 hours if you're catching fish. I don't know how to get around that except job rotation maybe, or.
Well, there's some, I've been trying to keep up on it, and there's great things I've been reading. It's like between 2 and 5 is, it's documented, those are the times you're gonna make the most mistakes, you know. Noise and vibration adds to exhaustion and sleep deprivation. You can reduce that, it can help you. It just seems like there's a lot of best practices out there.
Okay. Maybe those could be publicized better.
You know, those mouthpieces really make a difference in the quality of your sleep if you do have apnea, because a lot of what goes on with apnea is you wake up a lot, you're rolling, you're shifting, you don't realize it, but that shortness of breath causes this wakefulness, so you get a lot poorer quality of sleep. And just from my personal experience, once I started using that thing, I was a lot more rested after 6 or 8 hours of sleep than a lot more of restless sleep. So, it's an interesting anecdotal evidence, but it's.
That's where I think, if you have untreated sleep apnea, if you could get that diagnosed and treated before fishing season starts, I mean, you'd just be better off overall.
Well, I have sleep apnea, so I have a machine that I sleep with.
Yeah.
But when I had my test, it was 7 hours, and they hook you all up, and they have a infrared, I guess, video camera that watches you, and they're monitoring you. And when I took it, you had to have, in order for them to wake you up and make you put on a machine, you had to have you had to stop breathing for 10 seconds at least 20 times. I didn't quite get there.
Yeah.
I still have to wear it.
Okay.
But I sleep better, but I don't sleep any longer.
Right, yeah. Probably more alert during the day though.
Do you see yourself continuing this in the future? I mean, is this a one-shot thing, or is it funding related, or?
Yeah, well, it's funding related. I mean, I would like to continue in this. I mean, my personal history, I did a lot of children's environmental health work in Texas. I was a National Children's Study investigator within the National Children's Study, lost all this national funding, so I sort of switched gears and moved to Seattle. I run the residency program. I don't have a research focus yet, really, so I might continue this, if the opportunity arises. I enjoy it. Like I said, I really love it.
There might be some ways to make it less costly. I mean, you could possibly incorporate some local folks to help gather some of the information, do some of the stuff through the health fair in the spring when they have it, or and have people self-report a little bit more. I think it's a good idea on the logging of sleep or activity. Um, I think the Fitbits were great. They were kind of fun to fool around with.
Yeah,
But I know one of the things that I ran into with mine was not only remembering to key it to go to sleep, but to key it again once I was up.
Right.
And when you're on the boat and you're just catching a 20-minute nap, or maybe even sleeping an hour or two, it's really hard to remember to key that thing one way or the other. And then you jump up a lot of times, and you got to be on deck right now, and it's hard to remember to key it again or to come back, into the active mode. But, I think a lot of guys would be willing to do some logging, either in notebooks and then transfer it to computer, or to do it on some sort of a device. But, maybe some of that stuff would help make it more accurate and make it less expensive to do.
Is this public, the report of your study and findings?
We would like to publish the results. It's not a secret, but it's, if you'd like a copy of these slides, I'd be glad to
No, I
send
just
them to
thought
you,
it
for
might be
instance.
good for the fleet to read. I mean,
Yeah.
that they did, like, the hearing loss, and that might be good. It might be a wake-up call for some people. Maybe if you did a small synopsis or summary of your findings, and you give that to CDFU to blast out to their email list, it might.
That'd be good. National Fisherman contacted me, a reporter, they're not the historian, and the National Fisherman.
Oh, that would be really cool.
A lot of guys have that.
Yeah.
I got, go ahead.
No, good.
I was gonna say, ever since I remember them, there was ear protectors.
Yeah.
I mean, they've been around as long as I have. I mean, been using them for as long as I remember. You know,
I've heard a lot of people say, though, that the use increased in the last 10 years, the use of those. Maybe it's those Bose noise-canceling ones that are really good or easier to use.
and they're older than that. I've still got an old Bose, in fact, that I've got it, taped together and everything. But they were probably, that was probably 15 before that, I wore other,
Yeah, yeah.
been around a long time.
Do you wear it fishing, or do you have hobbies where you wear them
No,
too?
just strictly on the boat.
Yeah, yeah.
Yep.
You do any hunting or ATV riding or anything like that where it's noisy?
No, but it's not really, but I remember picking up who the hell's gun was it? Boom, what? It was like, you can't even do that once. You can actually, one shot can damage your ears.
Yeah.
You've got to wear, you know what I'm saying? That's, what is it, over 120 decibels or something?
No.
Bows and arrows, bow and arrow.
Yeah, or just,
You can, how you use it.
Well, thank you for coming, Deborah.
Pleasure.